This is really a very vital and important lecture. I'm sorry that the guests here, the guests of the McFadden Hotel, aren't here to get the benefit of it, but I'm sure that it will confirm many of the ideas that you have entertained for a long time, that you have studied in Dr. Shelton's books, and I'm certain that he will present his ideas, as he usually does, in a vivid and penetrating manner. And so here is Dr. Shelton.
Good afternoon, friends. After the tension of this morning, I hope that we can say something that will kind of relieve it, so we'll get back into a better mood and be happier than some of us seem to be right now. Unhappiness is one of the causes of the very thing I want to talk to you about this evening, or this afternoon. Tension is among the causes. So let's try to relax, let's try to poise ourselves, and I believe you'll even hear better in a state of poise. Maybe you'll understand more. I'm to talk to you this afternoon on the development and the causes, or development and the effects of toxemia. Before I begin to discuss it, let me define it. It's often well for us to know what we are talking about. If you consulted the medical dictionary and looked up the word toxemia, you'd find it listed about 9 or 10 times. And each time it would be defined with a slight variation of meaning to the preceding one. But always it would have more or less the same meaning. The word is derived from the Greek. It is a combination of two Greek roots, one of them meaning poisoning or poison, and the other meaning blood. It simply means poison blood. Now that is a simple meaning. But poison, the blood may be poisoned in many ways and from many sources. And we do not use the word toxemia in any indiscriminate manner as that it covers all kinds of poisoning to which one may be subjected. We do not use the word toxemia with any of the meanings that are given in the medical dictionary. Most of the meanings in the medical dictionary revolve around poisoning by bacteria. To us, bacterial poisoning, and there is such a thing, is a very minor factor in the production, or not in the production, but in the modification of the symptoms of disease. We do not regard bacteria as primary causes, but as secondary or tertiary, or even less than that. Merely superadded, complicating causes that are as helpless as a feather in a whirlwind in the absence of a primary toxemia, which is what I want to talk to you about. The human body, in common with all other animal bodies, is a poison factory. Everything that any part of our body does, everything that any cell in the body does, involves the production of waste. The cells are continuously giving off waste, and they're just as continuously taking in replenishment material, which we call food or nutriment. All of the waste of the cells of the body is toxic, so that the production of toxins or poisons in the body is as continuous as life itself. The cells of our bodies begin to pour out waste matter before birth, and they never cease to give off waste so long as we live, so that the production of poison is continuous. It's a day and night process. It goes on minute by minute and second by second. There is never a time during your lifetime that poisons are not being produced, not just here and there in the body, but in every cell in the body. And these toxins, these wastes, are excreted by the cell, and here is your primary excretion. They're excreted into the lymph that surrounds these cells. These poisons are taken up by the lymph and carried along the lymph stream, and finally the lymph mingles with the bloodstream, and it's taken up by the blood, and it is carried by the blood to the organs of excretion, where it is eliminated from the body. So long as the production of toxin on the one hand and the excretion of toxin on the other hand balance each other, we maintain a condition of physiological equilibrium so far as toxin is concerned. There is never a time in life when there are not toxins in the blood. There is never a time in life when toxins are not being removed from that blood, so long as the process of elimination or excretion is able to keep the toxin in the blood down to a physiological minimum. We do not call that condition toxemia. That is a normal state of the blood. There is a minimum, a physiological minimum, which is continuous. It becomes toxemia only when that toxin rises above that physiological minimum. That can occur only when the organs of elimination falter in their function. So long as their function is adequate, so long as their function is normal, they maintain a normal purity of the bloodstream. So that normal purity, normal sweetness and cleanliness of the blood, of the lymph, and of the tissues of the body depends upon normal elimination or normal excretion. In experiments in the laboratory in tissue culture, take, for example, the case of the chicken heart that Dr. Alexis Carrel kept alive for some 28 years. It was discovered that so long as that piece of tissue was regularly washed clean of the accumulated excretion of the tissue and given proper food, it would continue to live, and it remained in a useful condition. It did not age. But if the toxins were not washed away from it at stated intervals, it aged, and ultimately it died. The difference between your tissues, and your cells, and those in that test tube are just this. Your body makes its own culture medium, and your body has means of washing that culture medium free of toxins. And so long as that process of freeing the culture medium in which your cells live is adequate to maintain normal purity of that medium, then there isn't any reason why your cells should age, nor any reason why they should die. You too should maintain a state of youthfulness and of healthfulness and a length of life of which we yet haven't dreamed. This condition of toxemia, which results from the accumulation of the normal waste products of life. Metabolin is the technical term for it. Metabolites, some of the various component parts of it are concerned are called by the physiologists. End products of metabolism they're referred to as, but they're simply waste products thrown out by the cells. They're materials that the cells have used and have ceased to be useful. and they're thrown into the bloodstream. If they were allowed to accumulate, then the same thing would happen to your tissues and to your cells as happened to the cells in the laboratory when they're culturing them, when the culture medium is not washed clean of the debris from time to time. This condition of accumulated body waste, accumulated cellular waste, accumulated end products of metabolism, is what we call toxemia. Now, toxemia in this sense, bear in mind, is an auto-generated or poisoning or a self-poisoning. It is not poisoning from without. It is not poisoning by drugs. It is not bacterial poisoning. It is self-poisoning. It is a genuine self-poisoning. Most of the things that are referred to as self-poisoning is poisoning taken in from without. It used to be customary to talk about poisoning resulting from the absorption of toxins from the colon as self-poisoning. Auto-intoxication, they called it. That was not a genuine self-poisoning. That was poisoning from the outside. To make that more clear, let us get this fact in our minds. We live and move and have our being between two skins. We have an outer skin that we call a skin. And we have an inner skin that we call a membrane, which is merely another name for a skin. This inner skin we call the mucous membrane. It lines all of the hollow organs of the body that communicate either directly or indirectly with the outside world. It lines the entire digestive tract from mouth to anus. It lines the respiratory tract, the nose and the throat and the bronchial tubes and the lungs. It lines the tubes. It lines the biliary duct. It lines the gallbladder. It lines the little bile ducts in the liver itself. It lines the womb and the uterus, or the womb or uterus. It lines the vagina. It lines the fallopian tubes. It lines the bladder, the urethral tract. It lines the little tubules of the kidneys. It lines the ears and the eyes. It lines the pancreatic duct and the little tubules in the pancreas. It lines all of the hollow spaces of the body that communicate either directly or indirectly with the outside world. Now, we live between those two skins. Anything that has not passed through one or the other of those skins and gotten into the fluids and tissues beneath the skin is still outside of the body. So that we actually digest our food outside of the body. Food is prepared for absorption into the body before it's taken in. When we throw material out of the blood by the kidneys and put it into the bladder, it's already outside of the body. Material in the colon is outside of the body. Now, anything taken in from the digestive tract comes from the outside. Consequently, it is not a true self-poisoning. A true self-poisoning is that which we generate in our own tissues. It is merely the accumulation of the normal waste products of life. And bear in mind, every minute of our lives, asleep or awake, from birth to death, these waste products are being thrown into the lymph stream and carried by this and mingled with the bloodstream and taken by the blood to the organs of excretion to be thrown out. It is only when the organs of excretion falter in their function that these wastes can accumulate in the blood. If we maintain normal excretion or normal elimination, then there will be no accumulation of body waste. Consequently, there will develop no toxemia. If you will get a good textbook of toxicology and study the symptoms of poisoning as they're given there under the headings of the various drug poisons, and contrast those symptoms, or compare those symptoms with the symptoms that we see in illness, with the nausea, the vomiting, the diarrhea, the constipation, the nervous symptoms, the headache, the coughing, the sneezing, the rise in temperature, and the various other symptoms that we call symptoms of disease, you will discover that they're the same thing. The symptoms of poisoning and the symptoms of disease are the same thing. When you take a drug into your body, let's say you take it in by mouth, and you develop nausea, and it's followed by vomiting, what do you think that vomiting is? Dr. Curcio mentioned here the other night that people talk about resistance to disease as though disease is an organized and an entitative something or other that attacks from without, as is the common conception. It's true enough, the body resists, but it doesn't resist disease. When you analyze disease, you discover that disease is the process of resistance. You take a poison into your stomach and you throw it out by vomiting. Vomiting is the resistance and the expulsion of that poison. You take another drug and you pass it out by means of a diarrhea. Diarrhea is the process of resistance and expulsion. You're not resisting disease. Disease is the means by which, one of the means by which you resist. Disease is a process of resistance. Now, I want to modify that statement. Here's a man who is suffering with paralysis of the arm because of a destruction of the nerve in that arm. We class that as a disease. That isn't a process of resistance. That is not a remedial process. The word disease, as it's commonly used, is so broad in its implications that it covers a wide variety of different kind of phenomena that not only are different but often opposite to each other. So when we say disease is a remedial process, the word should be confined to those active and passive measures of the body that it uses in freeing itself of toxins and in repairing damages that are classed under that head. It should not refer to those conditions of the body that result from prior destruction of some part of the body. If a man has lost an arm, technically that man is suffering with a disease, because disease is defined in the dictionary as a departure from the normal, and certainly a one-armed man has departed from the normal. Normally we have two arms, but that is not a remedial process, that loss of an arm. That is the reason that in Volume 6 of the Hygienic System I insisted that we ought to drop the word disease from our vocabulary altogether and develop a new nomenclature, a new terminology, rather, to designate the different kinds of phenomena that are classed under disease. But what I want to bring to your attention now in referring to these evidences of poisoning is that when you become toxemic, you develop the same symptoms that you develop if you are poisoned with a drug of some kind. You develop the same nausea and vomiting and diarrhea and coughing and sneezing and running of the nose and spitting up of mucus and the fever and other symptoms that are classed as disease symptoms. And these too are efforts of the body to free itself of its toxic load. Toxemia, we designate the universal basic cause of disease. And this covers the whole field of so-called disease. The universal basic cause. Now, we do not mean by that there aren't other superadded and complicating causes. In addition to your toxemia, you may have food deficiencies that determine your symptoms in one direction rather than in the other. In addition to your toxemia, you may have poisoning from the intestinal tract, which complicates and intensifies the toxemic condition. Many complicating, adventitious elements may come in from without. You may have, in addition to your ordinary toxemia, tobacco poisoning or alcohol poisoning. Many other factors may complicate matters. But this is basic, and this is universal. The very first cold in infancy represents an established toxemia. The first hives, the first diarrhea of the infant represents an established toxemia. And due to our method of handling our children and caring for them, the toxemia persists throughout their life. A so-called acute disease is merely a crisis in toxemia. That crisis is a means of throwing off the toxic burden, but it never throws it all off. And besides, we live afterwards in such a way that we continue to build toxemia. Then we have another crisis, and we build some more toxemia with another crisis. And we keep having crises, colds, diarrheas, feverish spells, tonsillitis, and various other troubles, pneumonia, and on up the line. As we go along and build more and more toxemia, as we continue to live in such a way as to build it, we develop disease after disease after disease. Now, what are diseases? Symptom complexes. Well, let me give you an idea. I think I can. There is an old drug that was used for a variety of purposes. They used to put it on people to form blisters in the days when blistering was quite a common practice in the medical profession. They gave it internally for various conditions. It was known as Spanish fly. Now, the Spanish fly is an insect that is akin to our roaches. And by the way, they used to use roaches, too, to treat patients with. They used to dry and powder roaches and give them that for treatment. But the Spanish fly is a relative of the roach. And it contains a substance that is very acid, I believe, and it'll bring about a blistering of the skin with vesication and even destruction of skin with formation of pus and so forth. If you get enough of it on there, it's kept on long enough. But the point I want to bring out now is you apply it to the skin and you get inflammation of the skin. You take it internally and you get inflammation of the intestine. It gets into the bloodstream and is carried to the liver to be kidneys to be eliminated by the kidneys, and you get inflammation of the kidneys. Now you got inflammation in 3 parts: the skin, the intestine, the kidneys. And the Spanish fly is the cause of the occasion for the inflammation in each case. Now, according to the medical theory, we have 3 diseases. We have dermatitis, or inflammation of the skin. We have enteritis, or inflammation of the intestine. We have nephritis, or inflammation of the kidneys. We got 3 diseases, but we have one cause for the 3 diseases: Spanish fly. We've got a different group of symptoms in each case. In spite of the fact that it's the same cause, we've got a different group of symptoms in each case. Why? Because different organs are involved. To put that this way, the symptoms that are produced by inflammation in any part of the body depend upon the functions and the structure of the particular organ involved. The brain can't vomit. The stomach can't think. The lungs or the kidneys can't cough. The lungs can't urinate. You know what I mean now, I believe. If the inflammation is in the lungs, there'll be coughing. There'll be bringing up of sputum. There may be blood in it. There'll be pain in the chest. But if the inflammation is in the kidneys, the symptoms will be those characteristic of the kidneys. If the inflammation is in some other organ, the symptoms will be characteristic of the other organs. The inflammation will be the same in both cases. The cause may be the same in each case. Just like a bee sting on the thumb of the right hand will produce inflammation on the thumb with perhaps a stiffening of the thumb, and you can't use your hand very well. But if the same bee should sting you on the little toe on the left foot, he'd produce exactly the same condition in that toe. But it'd be toe symptoms instead of thumb symptoms in this case. But we've got the same cause. We've got the same condition. We've got it in different locations. We've got different symptoms because of the different functions of those different locations. So we've got a different symptom complex, a different complex of symptoms, or a different group of symptoms. They're characteristic of the organ involved, not of the inflammation. Now, if that's clear to you, you will understand how it is possible for a toxic state of the body to result in inflammation of the lungs in one person, inflammation of the kidneys in another person, inflammation of the intestine in the third, of the appendix in the fourth, of the tonsils in the fifth, and so on, depending upon the toxic state of the individual and the diathesis or tendencies of that particular individual. As these crises in toxemia come and go, they stress the organs involved in the remedial effort, so that changes away from the ideal take place in those structures. And time goes on, you keep having repeated crises until the condition becomes chronic. Instead of a cold, you've got chronic nasal catarrh. Chronic catarrh of the nose and throat. If you happen to be a neurotic, along with a chronic catarrh, the first thing you know, you have got asthmatic symptoms or hay fever symptoms. This is merely an evolutionary process, beginning with that first cold and going on stage by stage and step by step from the cold, ultimately to cancer, or to tuberculosis, or to Bright's disease, or to diabetes. There is an unbroken continuity in the pathological process from the development of that first cold to your ending in death at middle age or beyond from cancer. There is no time in the whole period of your life when that pathological process is broken. Why is the continuity of that pathological process never broken? Because the mode of living that is responsible for the toxemic condition is continued throughout life. Who makes an effort to correct the mode of living of the people? Do you go to a physician to have your mode of living corrected? He says, oh, don't worry about what you eat. Take this pill. Of course you don't have to give up smoking. I'll give you a dose of penicillin and you can smoke all you want. A woman went to put her son, into a tubercular hospital. And she said to the physician in charge, Doctor, do you think my son should stop smoking? He says, we can't deny the man the only pleasure he has in life. Even if that pleasure kills him or helps to, we can't deny it to him. Should I stop smoking? No. Smoke moderately. What is moderation in smoking? Well, he never tells you. He never gives you a criterion of moderation. He just says, smoke moderately. What shall I smoke? The best Havana cigar. Shall you give up drinking? Drink moderately. Buy the best whiskey. Shall I eat white bread? Oh, yes, especially now that it's enriched. Enriched white bread is actually better than whole grain bread. Sure. They never make any effort to correct your mode of living, so then you go, he doesn't, so then you consult the Christian Science. Oh, eat whatever you want to. Wrong eating is merely mortal error. Change your mind. Get your thoughts in proper perspective. Everything will take care of itself. So you drop the Christian Scientist and you go to an osteopath. He says, get down here on the table and I'll pull your leg and I'll twist you and I'll maul you a little bit. Everything will be all right. You can eat whatever you please. So you leave his office and you go to a chiropractor. And what does he say? He says, keep your spine in order and you can digest 10-penny nails. I remember when B.J. Palmer published instructions in the Fountainhead News during World War I telling chiropractors where to adjust for cooties. Believe it or not. Where to adjust for cooties. Yes, cooties. I still have the copy of the Fountainhead News in which that instruction is given. I've treasured it all the years. They don't correct your mode of living. So you go to a naturopath, or you go to a physiotherapist, or you go to somebody else. The only people who are trying to correct the mode of living of the people, the only people who are trying to educate you in a correct way of living are the hygienists. And because nobody teaches you the truth about life, because nobody teaches you how to live, because nobody tells you what you're doing to hurt yourself, you continue to live in such a way that you maintain that condition of toxemia. Now we learn to tolerate toxins, just as we learn to tolerate tobacco. I remember the first time I tried tobacco. I was a little shaver, and I had a sister that was just 2 years younger than I was, and we both, the practice of dipping snuff was quite prevalent in the neighborhood in which we lived. We conceived the idea that we would like to dip snuff. So we bothered our mother for days to let us dip snuff. And she continued to say no, no, no. Finally, she decided that she'd give us both a good lesson. So she handed me some money, and she said, run down to the store and buy a can of snuff. I went down and got a can of snuff, and she let each of us have a dip of snuff, and we took it in our snuff brushes, and we went to work. And in a couple of minutes, my sister began to get sick, and she got pale, and everything started coming up. Up to this time, nothing had bothered me, and I laughed at her. My mother didn't say anything. She just kind of smiled and watched. The minute I felt a little nausea coming on, so I went out the back door and I ran down to the barn. Of course, my mother knew what was coming, so she came on down there. And I got down, and I think I got everything up except my socks. Now, that's our first experience with tobacco. It makes us sick. But we can keep taking it. You know, in the process of becoming a man, you've got to learn to smoke. You know, last evening, after I finished my talk here, I went back there and I was standing in the rear, and a man walked up to me and he handed me a almost full package of cigarettes. There may have been one or two taken out of it, and he handed me 2 little packages of matches. He says, here, I am never going to smoke again. I don't know why he gave me the tobacco, because I don't smoke either. At any rate, I had my lesson, but I watched others, and they'd get sick too. And then they'd keep it up, a little dose, a little smaller dose, a little larger dose, a little larger dose. After a while, they not only got so they took the stuff, they got so they thought they liked it. And they got so they couldn't quit. I've seen them quit dozens of times, throw their tobacco away in the morning and go and buy some more in the afternoon. They just couldn't stop. They didn't have what it took. But you get so you tolerate more and more and more. So you start out, the first half of a cigarette makes you nicely, very sick. After a while, you're smoking 2 and 3 packages of cigarettes a day. You're irritable and cranky and nervous if you haven't got them. Now, you're just as irritable and cranky and nervous when you have them. Only you're narcotized. You don't realize it. When you don't take them, then you realize what your true condition is. You're just as sick with them as without them. And just as soon as you feel the slightest discomfort, you re-narcotize yourself by having another coffin nail. And when that narcotic is eliminated so that you begin to feel just the slightest discomfort, you take another coffin nail and re-narcotize yourself. That's the essence of addiction. Re-narcotizing yourself to smother the unease and discomfort and distress that results from the prior use of the same narcotic. That's all there is to addiction. Well, anyhow, you learn to tolerate more and more toxins. But toleration is chronic disease. You no longer develop acute troubles. You simply have chronic troubles. Chronic catarrh, chronic hay fever, chronic bronchitis, chronic gastritis, chronic colitis, chronic metritis, chronic cystitis, chronic something or other, and arthritis, and so on and so forth. Your disease is no longer, your toxemia is no longer manifested primarily as acute disease, but as chronic disease. And in your chronic condition, you have from time to time acute crises, as the toxemia rises above the toleration point. Now, why does it rise above the toleration point? Because in the low condition of your functioning power, your organs of excretion are able to maintain a more or less uniform level of the toxic state along about where you have learned to tolerate it. But something throws an added stress or an added strain upon those organs of elimination. Worry, fear, anxiety, grief, overwork, lack of sleep, becoming chilled, becoming overheated, a heavy meal, an unaccustomed meal, unaccustomed amount of your custom stimulation throws an added strain upon those organs of elimination, and they falter still more, and there's a sudden rise in toxemia, and this necessitates another house cleaning. But it doesn't reduce the toxins to the point of pure blood, purity of blood. It gets them down to or slightly below the point of toleration, so you start off again with the toxin. And it is because toxemia is continuous that the disease from which you suffer is continuous. And it is because it is continuous, because that toxin affects every tissue in the body and brings about constant irritation and degeneration of those tissues, that organ after organ falters in its function, and you develop complications, as they call them, after complications as you go along. You develop Bright's disease, and you discover that failing vision is a complication of Bright's disease, or it's a complication of diabetes. Whichever function fails first, the disease is named after that, and whatever function fails after it becomes a complication. A complication in what? A complication of diabetes or of nephritis? Not on your life. It's a complication of the poisoning. It's a complication of toxemia. Complications are the result of the same causes that produce the trouble that they name the primary disease, plus the troubles that are produced by the treatments. We've got a whole family. It's a very large family of diseases that belong to the itis, under the itis name. You have rhinitis, which is inflammation of the nose. And you have tonsillitis, which is inflammation of the tonsil. And you have pharyngitis, which is inflammation of the pharynx. And laryngitis, which is inflammation of the larynx. And bronchitis, which is inflammation of the bronchial tube. And gastritis, which is inflammation of the stomach. And enteritis, which is inflammation of the intestine. And colitis, which is inflammation of the colon. And President Eisenhower popularized ileitis, which is inflammation of the ileum. And then you have nephritis, which is inflammation of the kidneys, and metritis, which is inflammation of the womb, and cystitis, which is inflammation of the bladder, and cholecystitis, which is inflammation of the gallbladder. Then you have, this is a very rare disease, you have phrenitis, which is inflammation of the brain. Now, I say that's a very rare disease. Brains are too rare for us to have that particular disease very often. Now, there are many other itises. I do not need to name them all. What I want to point out about the itises is just this one simple fact. Itis is a little Greek suffix meaning inflammation. Wherever you see that term, that suffix at the end of a word, itis, that little suffix itis at the end of a word, you know that it means inflammation. If you look at the first part of the word, you'll discover where the inflammation is located. And think of the numerous diseases that come under that heading. You've got inflammation in 1,000 places. And just imagine yourself going down the digestive tract. You go down the digestive tract. Start with the mouth. You've got stomatitis. Now that sounds like stomach, doesn't it? But actually it's inflammation of the mouth. You can have esophagitis, which is inflammation of the esophagus. And then you go on further down, you can have gastritis. But you can have inflammation of the pylorus, and that would be pyloritis. And you could follow up the digestive tract right on down, you have ileitis and jejunitis and colitis and sigmoiditis and proctitis and so on. All the length of the digestive tract, you can have an itis. It's all the same thing. It's inflammation of a mucous membrane. But it's a different disease because it's located. As a matter of fact, while you can't find with the aid of a microscope a line of division between sigmoiditis and proctitis, the inflammation may extend all the way through the whole of the rectum, on up in through the sigmoid, so you've got two diseases, although it's all one inflammatory process. Now, this is the way that diseases have been artificially divided up. Each little quarter of an inch of anatomy calls for another name. Even though there is no dividing line, each little quarter of an inch calls for another name. You're dealing with the same condition, or rather the same action, because inflammation is an action, in many different parts of the body. We in the hygienic field do not recognize many diseases. Disease to us is a unit. We realize that we have many manifestations, many symptom complexes, but basically we are dealing with identically the same systemic condition and the same systemic actions in remedying that condition, even though it takes one channel in one case and another channel in another. We're dealing with one so-called disease. So we don't have to give you penicillin for one inflammation, streptomycin for another, aureomycin for a third, and something else for a fourth, and something else for a fifth. And this simplifies matters in another way. It is not so important that we make an accurate diagnosis in order to properly care for our patients. Now, who makes an accurate diagnosis? Diagnosis is 90% guesswork. And there isn't a physician living. There isn't a doctor in any other school of so-called healing living that would be willing to take an oath that he is right in 50% of his diagnosis. If this is necessary to proper treatment, then at least in 50% of cases, they're treating their patients for diseases they don't have. And consequently, they're treating them wrongly. Now, imagine a man treating a patient for appendicitis, and it turns out he's got smallpox. Paul de Christ, in his book, Our Medicine Men, tells of an incident in the West where he was called in. Where 7 people were taken to the hospital with the diagnosis of appendicitis to be operated on for the removal of their appendix. And on the following day after they arrived, the 7 of them broke out with smallpox. In World War I, it was impossible for any American soldier to have typhoid fever. Now, you know why it was impossible. They had all been completely and thoroughly immunized, so nobody had typhoid. Everybody that died of influenza, because influenza was a blanket term that covered what have you. Everything from a cold to typhoid or pneumonia was called influenza. In one outfit in France of American soldiers, 145 deaths were autopsied. They autopsied all of them, I think. But in 145 cases of death, autopsy showed that they died of typhoid, whereas the diagnosis was influenza and the treatment was for influenza. Now, we wouldn't have had that kind of trouble even if we had made a mistake in diagnosis. What we did for our patient would have been equally valuable whether he had influenza or typhoid. The important thing in hygienic treatment is not to name the symptom complex present, but to locate the cause behind that symptom complex. We search for causes. The other fellow looks for symptoms. Causes are the important thing. Back of every pathology and back of every symptomatology, there lies cause. And if we do not find cause, well, we can treat symptoms. We can give you a cough syrup to stop you from coughing. We can give you an antipyretic to reduce your fever. We can give you an anodyne to relieve your pain. We can give you something else to do something else, and so on through the list. If you're constipated, we can give you a cathartic, even a drastic. And you'll have a bowel movement, but you'll still be constipated. Why? Because we haven't removed the cause. It is necessary to remove cause, and in our work we search for cause. Oh, it's all right. I sit down and listen to my patients. I take a full case history of all of my patients. They go through all their past and their present. It's necessary to understand what they've been through. It's necessary that I do this to find out what kind of abuse they've been subjected to, how many operations they've had, what's left of them. Sometimes they get nothing left but a shell. Everything's been taken out that could be taken out without producing instantaneous death. Not much left to work on. But I have to sit and listen to it all, and I go over all their past symptoms and their past treatments, and I hear it all, and I go through it with them. It's as much for their sake as mine, because they want to get it off their chest. And after they get through telling me the whole story, what have they told me? They've given me a mass of symptoms, a mass of effects, a mass of results, and a long story of abuses. But I still don't know what's the cause of their trouble. I've got to look elsewhere for cause. Oh, you come in and you say, I got a headache. I had a woman come into me once and she said, Dr. Shelton, I suffer with severe headaches, and I've had them for years and nobody can help me. And I know it's due to my constipation. If I could just get rid of constipation, I know I'd be all right. I wouldn't have any more headaches. And I said to her, you've got the cart before the horse. If you get rid of your headaches, you won't have any more constipation. You're crazy, she said. And I said, I know it. And so are you. And she said, what do you mean? I said, I mean constipation is a symptom, headache is a symptom, and symptoms don't cause each other. But back of the constipation and back of the headache is the same cause. Now let's find the cause and remove it, and you'll be rid of both symptoms. And that's what we did. Cause is the important thing. I'm going to discuss this more fully when we come to discuss the process of getting well. I just had to bring this in now to help fortify what we're saying. It is not diseases that we treat. It's causes we must remove. So, I must hasten on now and give you some information about how we produce the condition that we call toxemia. I have already emphasized that it is impossible for toxemia to develop so long as we have normal elimination. Toxemia is the result of inhibited elimination, of a checking of elimination. Now, we discussed for you the first evening the process of nutrition, the process of drainage, and the control of the overall control of these two major processes of life. The nervous system is the major control system of the body. So long as we have abundant supply of nerve energy, function is normal. When nerve energy is low, function lags. The condition that we referred to the other night as a lowering of functioning power, we generally subsume under the term enervation, which means a state of lowered nerve energy. Enervation, or lowered nerve energy, is the result of the using up of nerve energy in excess. I don't know what nerve energy is. I know that it's said that we don't store up nerve energy. There are those who hold that we store it up as in the brain and in the cord as we store up electricity in a storage battery. There are others who hold that we generate it as we go along as we need it. There are some who think it's some kind of a spiritual force, and others think it's electricity, and others think it's something else, and some say there's no such thing as nerve energy, that there's just a nerve impulse. How they can have an impulse without energy is something they have never explained. It doesn't make any difference what it is. I don't know. I don't think I'll ever know. I don't think that's important. Whether it's an impulse or an electrical current or what it is no importance. The point is that when it's low, or when our ability to generate it is reduced, whatever we store up, let's say we store up a pro-energy, and then we make it as we go along out of that. When that is low, it doesn't matter. When nerve energy is low, so that an insufficient number of nerve impulses are reaching an organ, the function of that organ fags. It fails in its function. Its function is reduced. It does not carry on in a normal way. Now, our nerve energy is a fluctuating thing. It varies from day to day and from hour to hour, depending upon our activities, depending upon our circumstances and conditions, depending upon our emotional life and our physical life, and so on. Every excess uses up or lowers it, whatever we want to call it. Every stimulation lowers nerve energy. Every emotional tantrum lowers it. All of the treatments that we employ to force action or to reduce action lowers it. A friend of mine was recently taken to the hospital. He had heart trouble. He was put under sedation. He was also put under an oxygen tent. Now, I have never yet been able to make up my mind which is worse, the sedation or the oxygen tent. You know, you've read about it many times. They put premature babies in incubators and give them oxygen, and it makes them blind. Blinds them. A little excess of oxygen produces blindness. Oxygen is absolutely necessary to life, but an excess of it is damaging. Now, do you imagine for a minute that excess of oxygen damages the eyes only, that it produces blindness in the child and doesn't affect a single other tissue in the body? I don't. Do you imagine that it affects only the infant, that the adult can take it without any harmful effects whatsoever? I don't. I have never yet, I don't say that nobody ever recovered, but I have never seen anybody recover when he was put under an oxygen tent. They all die. Now, maybe some recover. I've never seen one. It has been my opinion that the oxygen tent is a last grandstand performance put on by the profession just before they turn the patient over to the undertaker. But I can't make up my mind which is worse, the sedation or the oxygen tent. At any rate, whether we give the patient a stimulant or a sedative, in either case, the nerve energy of that individual is lowered. Any lowering of nerve energy by an excess of normal activities or by any other type of activity lowers function. It checks excretion. It checks secretion. The nutritive forces of the body are impaired along with the excretory functions of the body by the same lowering of nerve energy. Many of the things that we refer to as food deficiencies are not due to the fact that the element of food that we need is not in our diet. In anemia, for example, a patient dies of progressive pernicious anemia, and they analyze him after death and they find an abundance of iron stored away in his tissues. But he isn't making blood. He died because he was not able to make blood. Now, why? Not because of a deficiency in iron, perhaps not because of a deficiency of copper, not because of a deficiency of vitamins, but because of a deficiency in himself. The toxins in his body were interfering with the normal operations of his body, normal blood-making operations. The checking of secretion interfered with the nutritive processes to such an extent that he was not able to perform the processes of life that are required to maintain that life. We free our patients of their toxic load and then feed them. Oh, I get patients galore who have been through the mill. They have had diets and diets and diets. They've been to specialists and specialists and specialists. They've taken vitamins by the bushel. and they're still sick. We clean them out, and then we feed them. And they make use of their food. Give them these things before they are freed of their toxins and before their nerve energy is restored so that they have normal functioning power, and they don't make use of them. Get rid of the toxins first by fasting, that which is the best and shortest and sharp and fastest way. Restore nerve energy with rest. And then they can eat their food, they can digest it, they can assimilate it, they can make use of it. The vitamins are present. Now, of course, you couldn't get vitamins out of white flour, and out of white rice, and out of white sugar, and out of the other denatured foods. We don't feed that kind of a diet down at our place. We don't feed canned goods down there. You can't get them out of those. If you're going to go back to the same old mode of living after you've had your fast and so forth that you had before, you're soon going to redevelop the same trouble because you're going to produce the same innervation. You're going to produce the same toxemia. You're going to produce the same food deficiencies. So what's the use? If you're going to kill yourself, why do it in a hurry? Tomorrow evening, I believe Dr. Curcio talks tomorrow afternoon, and I talk tomorrow evening. What are your talk subjects tomorrow, Dr. Curcio? What is it? Oh, he knows. You don't. You don't even know what you're going to talk about. You ought to come and hear this one. Tomorrow evening, I will talk to you on the means of restoring functioning power. Last evening, I talked to you on how we reduce our functioning power. Tomorrow evening, I'm going to tell you how to restore your functioning power. And this means of restoring functioning power is your royal road back to health. But don't forget Dr. Curcio's lecture tomorrow evening, or tomorrow afternoon, and the lecture tomorrow evening. Oh, wait a minute. It's tonight you lecture again, isn't it? We must not skip tonight. He's going to talk tonight. Do you know what you're talking on tonight? You're going to... Mr. Google says he'll announce that. He's sitting over here making faces at me again, so I'm going to quit. I think I'm going to answer some questions for you.
I think you'll agree with me that Dr. Shelton is one of the finest examples of energy. And I think if we followed his ideas as he follows his own, we'd probably have the same amount of vitality that he exhibits in all his lectures. I know some of you have heard of Harry Golden. How many have heard of Harry Golden? Harry Golden happens to be a classmate of mine, and in reading his newspaper called the Carolina Israelite, he has a great deal of ideas about food. And, of course, he's inclined to be humorous. And I recall on one of his radio broadcasts recently, he was vaunting, he was indicating how the Jewish people were supreme in their devotion to eating. And he said, do you know, he said, that when the cavemen were still gnawing on bones in their caves, the Jewish people already had diabetes. Now will you take over and answer some questions?
You know, it's been several years since I opened a medical textbook, but I remember the textbooks on the practice of medicine used to give, among the causes of diabetes, Jewish race. You know, they used to also say male sex. But nowadays, since there's more diabetes among females than there is males, I think they're going to have to include female sex. All right, let's have your first question. Mr. Wangler, were you trying to ask one?
That's right. You say toxemia develops from the cells that have died off.
No, not the cells that have died off. They're the waste products from the normal activities of cells.
and they're not very off properly. But what we see, because of food that they provide, because of no digestion, what is that?
That is, we class that as an infection. In other words, that is the poisoning from the outside. We use the term infection. It's a very old term. You'll find it defined in the medical dictionary today. You'll find it defined as an invasion of the body by microbes. But previous to the microbe idea, it still had that significance of external poisoning.
In other words, the only thing that causes toxemia then is that waste matter.
Well, toxemia could be broadly defined to be present in the lymph secretion in cells of poison from any source, of any character, but we limit it to metabolic waste, and the others as accidental superadditions to that toxemic state. All right, your question is...
What difference does it make that you look at the disease? As long as the person is complaining and feels disease or is positive of disease, you treat them with the same. Why don't you
We do not treat disease, and we do not treat patients. We remove causes. I'll discuss this more fully when we come to discussing that subject in a subsequent lecture. I believe it's day after tomorrow. I discuss the subject of recovering health, and I will discuss that more fully. We do not treat disease. We do not treat pneumonia. We do not treat typhoid. We do not treat appendicitis. That is not hygiene. Treating disease is not our work. Removing cause is not the same in each case, because cause is not always the same.
You mentioned a person who has asthma as a neurologist. I just didn't get the significance of that.
Technically, a neurotic is a person who has a tendency towards nervous diseases. A neurotic does not necessarily mean somebody who is suffering with severe mental and nervous symptoms. A neurotic individual may be apparently normal, but he has a tendency towards nervous diseases. Just as a man may be called a rheumatic who doesn't have rheumatism, but who has a tendency to develop rheumatism instead of something else. So the person, in all cases of hay fever and asthma, you have this nervous involvement. You have the tension, perhaps, for example, in the respiratory passages that interferes with breathing in asthma is a neurotic condition. Without the neurosis, the patient would simply have catarrh. With the neurosis, he has a complicated condition that we call asthma. All right, have we another question? Yes.
I understand that there cannot be toxemia except when it's out of the digestive system, that is beyond between the outer skin and the inner skin. There is no toxemia, there is no occurrence of toxemia within the walls of the stomach, within the walls of the intestine, that is in the intestinal tract itself, or in the esophagus. You said there is two walls.
Yeah, that's right.
Now, when it's not within those two walls, between the two walls, there is no toxemia.
No, there is no toxemia. You can take poison into the intestinal tract and have symptoms: vomiting, diarrhea, nausea, various other symptoms. You can even faint as a consequence of their presence. This is due to the fact that the presence of toxins in these cavities results in severe irritation of the nerve endings of these things, and they result in various symptoms that are designed to throw these poisons out before they get into the bloodstream. But toxemia is of the blood. In the cavities of the body, that is, in the intestinal tract, it's still outside the body. All right, the next question. Can fasting do what? Fasting doesn't cure anything. We don't use the term cure in hygiene. We don't cure disease. We're not engaged in curing disease. Fasting is a period of physiological rest, during which time the body does for itself many things that it can't possibly do under a state of of repletion such as we commonly exist under. It does under periods of rest what it can't do under periods of full speed ahead. Fasting is not a cure, but a rest that enables the body to do for itself. Now, a neurosis is due to a variety of, or a complication of causes. To really get rid of the neurosis, one must find all the causes. The fasting is helpful in getting rid of the toxemia. The rest in bed is helpful in giving the nervous system an opportunity to repair itself. But in addition to this, the causes that have produced the enervation, the causes that have resulted in the nervous depletion, must also be found and removed. You can't remove, for example, a bad habit by fasting. You can't remove an emotional state by fasting. That we have to do by emotional recultivation. All right. Next question. Yes. Sure you may.
Breaking out permanently the skin of the face only when a little child, 3.5 years old, actually was touched. You see every one of those things. Of course, you need the conventional way.
Well, that's enough. Conventional eating is enough to produce anything, and we would judge by the fact that he eats conventionally that he also is cared for in every other way conventionally. And I venture to say that if we had the child here and the mother, so that we could go into all of the habits of living of that child and all the conditions and circumstances surrounding that child's life, we could find ample cause for that and much more. But just to guess at cause in a particular case isn't right. We have to take each case and go into the case, go into the living habits, into the eating habits, the sex habits, the emotional habits, the drinking habits, the smoking habits, the working habits, and all the other habits of life in order to find out which particular things this particular individual is doing that is hurting, and which particular things he's living undone that is hurting. We both do positive and negative things in producing our troubles, but in each case we have to analyze each case separately. We just can't lay down blanket causes and blanket prescriptions. Your question. Well, let me ask you a question. Did you not say that you were in a coma during that time? Well, now let me ask you another question. How do you know what you did? How do you know what would have happened? Well, they didn't take in any oxygen if they weren't functioning. If your lungs were not functioning, they did not take in oxygen whether you had it in a tent or some other place. In an accident, things have to be done as accidents. In other words, if I had a dislocated shoulder, that's a mechanical thing, and I'd have it mechanically taken care of. If I dislocated my hip or my mandible, that's also a mechanical thing, and I'd have it mechanically taken care of. If I sustained a severe wound, I'd have a surgeon look after it. Yes, in accidents, hygiene can help in accidents, but hygiene alone is not enough in accidents, in many of them at least. We need other things. But I gave you my experience. I did not say that everybody who ever went under an oxygen tent died. I said all that I've ever seen died. You survived. Thanks. I'm glad you did. Well, I doubt it very much. I doubt it very much. Now the next question. Well, anybody that is sufficiently qualified to do it. A good chiropractor might do it, a good osteopath might do it, a good medical man might do it, a good naturopath might do it, a good hygienist might do it, a good bone setter might do it. It depends on who's handy under the circumstances. Yes?
What about things like insect stings and why are they attracted to certain types of skins and not to others?
Well, I doubt very much that they're attracted to certain types of skins and not to others. There isn't anything to do for them. They get well quickly enough. But the best thing is to keep away from the insects. All right, have we another question? Yes? Well, we would offer the same objections to the new drugs that we offer to all the old ones. There isn't any difference. Let them make all the claims they want for them. They are making identically the same claims for their antibiotics today that they made for mercury and quinine 75 years ago. These were the miracle drugs in those days, and these were almost universally used. They used them in everything, in large doses and small doses, in everything from a cold to consumption, in everything from a pimple to cancer. Mercury and quinine were the sheet anchor of treatment. They're running true to pattern. Now, because they make these big claims doesn't mean anything. You see for yourself the people all around you. They're still sick. Not only are they still sick, they're growing sicker. The army of invalids in this country is increasing year by year, and in the face of their claims that they're doing things with these poisonous substances, the army of invalids increases. Now, last winter, or was it winter before last, I met a young woman. She had pneumonia. She was treated with antibiotics. She was said to be cured. About 3 weeks later, she developed pneumonia. She was again cured. A few weeks later, she developed pneumonia. She was again cured. Now, there was nothing like getting well in either case. If she had gotten well the first time, truly gotten well, she wouldn't have had the second and the third cases. What they did was suppress the symptoms with their antibiotics. The body threw off the antibiotics, and it redeveloped the pneumonia. Now, suppressing symptoms with any means whatsoever does not constitute removing cause. Whether it's steroids or antibiotics or any other drug, you do not remove cause when you administer these things in symptomatic treatment. They produce evils of their own, but they remove no causes. They're not necessary to health, therefore they produce no health. And these are primarily, basically, our objections to them. I could go into all the troubles that result from your antibiotics, the skin eruptions, the asthmatic symptoms, the nausea, the vomiting, the fever, and even the deaths that result from them. And there has been a worldwide slaughter with these antibiotics. I get reports from all parts of the world, in medical journals and in newspapers. I get them from Greece and from Europe and from Japan and elsewhere. With antibiotics, there has been carried on for the past several years a worldwide slaughter. And the protest against it is even beginning to invade the medical profession. There are medical men that are now saying, let's stop using these things. Yes.
Why does a person have an excessive phlegm or mucus?
Two words for the same substance, mucus or phlegm. One is Latin, the other is Greek. This is what we know as a catarrhal condition. It means that there is inflammation of a mucous surface. Primarily, there's a toxic state. But notice this in your catarrhal condition. Drink a little milk and watch the amount of mucus increase. Overeat on starches and sugars and fats and watch the amount of mucus increase. Take the milk out of your diet or the excess starches and sugars and fats out of your diet and see the mucus decrease. You'll see that excesses of certain types of food will increase your catarrhal state. Cut these down and you'll see that your catarrhal state decreases. Now, it doesn't matter whether you have just an ordinary bronchitis or rhinitis or have asthma and hay fever. You'll see the same thing happen by an alteration in your mode of living. Often that is not enough to get well of the condition. You need a complete cleaning out in most cases to get fully well of it. Yes. Come ahead, yes.
The children who have had all 3 or 4 sore shots and from
the selling of the Salk vaccine to the American public was one of the cleverest sales jobs I think I have ever seen. Of course, it was done by lies and falsehoods. It was done by statistical juggling. They told you that the Salk vaccine was 10%. It protected 90% of the children that were vaccinated. Now, actually, in no epidemic of polio anywhere in the world within recorded history has more than 2.5% of the people ever had polio. They protect all but 10%. You see, nobody needed protection. Only a handful would ever have the trouble. Now, the Salk vaccine is not different to any other vaccine or serum. It is a foreign protein that they're injecting into the body, and it results in anaphylactic reactions, as they call them, just as other vaccines and serums do. The Salk vaccine has already resulted in a number of deaths from the vaccine. They are attributed by medical men to the vaccine. It has resulted in much damage. In addition to that, there has been no decrease in polio. Now, they picture you a decrease, they give you statistics to show you a decrease, but how do they do it? Before Salk, they diagnosed thousands of cases every year as polio that today they're not diagnosing as polio. They admit it, they state it. So by eliminating all those cases that they used to diagnose as polio from their statistics, they show a reduction in polio. Recently, a report was given in Dallas of some polio cases there. There were 5 cases of polio developed in 1 week. 3 of the 5 had had 3 Salk shots. 3 of 5, 2 had not had, or 2 they didn't say whether they had had 1 or 2 or what. 3 had had 3 shots. In other words, a majority of these 5 cases had had 3 Salk shots. They will tell you, they were all paralytic polio. They will tell you that there is more polio, more paralytic polio among the unvaccinated than among the vaccinated. But if you will watch the story as it comes in the newspapers when they report the actual cases, you will discover that so far as the public reports are concerned, this is not so. Now, that's point 2. The third point. Already in this country and in Europe, there is a growing demand in the medical profession to discontinue the use of the Salk vaccine and to use a different one. They're not satisfied themselves. Yes.
My mind, about 78 years old, the doctor brought me to the hospital. And I said, why? He said, because when I drink liquor, I get excited. I said, why do you drink liquor? He said, because the doctor says liquor tends to dilate the arteries, and I have blood pressure. He said, why do you have blood pressure? He said, because I smoke, and that constricts the arteries. And the doctor says, smoking other things, that's liquor related. But why does the doctor say, stop smoking? Well, he's not told that when he's a needle, I must have cigarettes, but I can enjoy them, he's not tested. And he said, when I don't smoke, I can leave my bowels on move. I do recommend liquor, drinks that elderly people, they drink a liquor, dilate the arteries, and also the effect of cigarettes that constrict the arteries into the arteries.
I'd like to call your attention to the fact that he is not talking about doctors but physicians. They do all that they know. That's all they know. They haven't been taught anything else. They make a great fuss about the enormous amount of time they spend in college learning their profession. Remember the remark made by, I believe it was Mark Twain, what's the use of knowing so much if what you know isn't so? Wasn't it Josh Billings who said many people spend their lives in the accumulation of ignorance? Well, they spend 8 years in accumulating ignorance. They do all that they know.
The point is that they live by it.
That's all they have. They don't have anything else to live by. Now, a physician is not trained to remove cause or even to search for cause. I remember once a physician in New York that I was well acquainted with. As a matter of fact, he said, Dr. Shelton, we need you in the medical profession. We need minds like yours in the medical profession. Why don't you study medicine and come in with us? I was very well acquainted with this man. I went down one day to see a picture, calling Dr. Kildare. Some of you may remember, it was the first of the Dr. Kildare pictures. The young Dr. Kildare said to the house physician, he said, when I was in medical college, I didn't think much of diagnosis. But since I'm here in the hospital, he says, I think diagnosis is the most important part of medicine. He says, I'm going to make diagnosis my specialty. So the house physician encouraged him in it. And I told this physician about it, and I said, what do you think of it, doctor? Ah, he says, diagnosis is very important. And he started telling me about this and that he had done and how he diagnosed. And I said, doctor, after you do all these things, what have you got? You've just got an accumulation of effects, of results. What about the causes? Ah, etiology is very important. I always look for etiology. I said, doctor, you mean you look for enlarged tonsils? Inflamed appendices? Yes, I always look for etiology. I said, doctor, that's not etiology. That's part of the patient's symptoms. That's part of his pathology. That's part of the trouble. We want to know real causes. The man was completely stumped. He didn't know which way to go. I was called in on consultation in which this same man was present once. There was one other medical man who was an endocrinologist, and there was a naturopath there, and I was there. And they had a young fellow there that looked like a walking osteological museum. He was so thin that he was skin and bones, and there wasn't much skin. And all three of them had treated him at various times. And before I got to New York, they had sent a sample of urine and a sample of blood to the laboratory, and they had their reports back, and there they got there, and they started going over these reports and re-examining the young man, and they talked very learnedly. They were using their $15 words, and I couldn't tell whether they were trying to impress me or to club the poor patient over the head. At any rate, I went over and sat down on a table there in the office and started reading something. And in a few minutes, this man came over and he said, Dr. Shelton, this particular physician, he said, we want to hear from you. What have you got to say? You haven't said a word. I said, I'll be ready to talk when you get around to talking about causes. Causes, that's just what we're talking about. Dr. So-and-so has just been talking about causes. I said, all right, what's the cause? The man, his glands are out of order. I said, oh, that's the cause. Yes. Well, I said, what caused the glands to be out of order? Oh, the man is nervous. Oh, I said, well, then that's the cause. Yes, nervousness is the cause. Well, I said, what caused the nervousness? Oh, he's emaciated. He's very emaciated. He's very run down. Oh, I said, that's the cause. Yes. Well, what caused the emaciation? Well, we don't know. I said, all right, now that you don't know the cause, what are you going to do? Well, we got to build him up. We got to feed him. And I said, haven't you been trying that for months? Yes. Well, now what do you propose to do? We got to give him gland extracts to enable him to use his food. And I said, haven't you already tried that? Yes. I said, what are you going to do next? I don't know. What do you propose to do? I said, I'd put the man on a fast. But he's skin and bones. I said, I'd still give him a fast. The amazing thing about this consultation was that the endocrinologist turned to me and he said, Dr. Shelton, if you won't give this man the fast, won't fast him too long, I'll approve it. I said, fast him too long? How long can you fast this little stack of bones? He was anemic. He had hemorrhoids. And he had a spinal curvature, and he had a lot of other troubles. They sent him to me. He came all the way down to San Antonio in that pitiable condition. When I got through with him, we went to Philadelphia and entered the osteopathic college. Now, these people do what they are taught to do. They don't know anything about cause. They don't know enough to search for cause. One of the leading medical men in these United States made the statement in the Journal of the American Medical Association several years ago that searching for cause, or rather removing cause, is quackery. Removing cause is quackery. Now, quackery comes from the old German Quacksalber, which means quicksilver, which means mercury. It was really applied to the fellow who poisoned his patients with mercury. The only quacks in the world are the medical profession. All right, well, let's give them one more question. I think there's one more out there. Breathing is automatically adjusted to our needs. We learn to breathe a few seconds after we're born, and when we forget how, we die.